Back here in the country, the government is working to make cancer care management more affordable by creating public awareness on early detection as well as prevention. Arise correspondent Georgina Nwokwu has this story for us.
On February 4 every year, the world unites to raise awareness on fundamental cancer issues. For the African continent, the cancer situation is becoming worrisome. According to the World Health Organization, approximately 1.1 million new cancer cases occurred in Africa, with around 700,000 deaths in 2020. In 2023, Nigeria recorded 124,000 new cancer cases. Sadly, the high cost of cancer care in the midst of growing poverty is the leading cause of cancer morbidity and mortality.
By empowering individuals with knowledge, we aim to reduce the incidence of late-stage cancer diagnosis and improve early detection rates across Nigeria.
The Nigerian government says it is now determined to bridge the cancer care gap in the country through advanced cancer research, funding, and collaboration with international organizations.
This partnership is aimed to leveraging expertise, resources, and best practices to enhance the quality of care for young cancer patients in Nigeria.
The institutions in Nigeria that carry out cancer care, one of those ones that have come on board recently is University of Maiduguri Teaching Hospital with state-of-the-art LINAC machines. And hopefully soon would have another center in Abuja which will relieve the pressure.
We are aware that there have been some difficulties in assessing the CHF, but this will be a thing of the past. Working with the Federal Ministry of Health, NICRAT has developed a framework which will ensure that payment for the patients is prompt.
This year's World Cancer Day commemoration, organized by the National Institute of Cancer Research and Treatment, has brought together health experts to discuss ways to improve cancer care access and management challenges.
Increasing awareness on the preventive aspects of cancer, knowing that about 30 to 50% of cancers can be prevented. So if the emphases are more on that, we're looking at health protection, health promotion, and then health prevention.
The National Health Insurance Authority has made health insurance mandatory for all Nigerians. This was in the new Act of 2022. Therefore, the NHIA is expected to enroll all Nigerians, including cancer patients, into health insurance.
The people, as much as possible, should eat wisely, sugary foods, excessive carbohydrate intake, excessive saturated fats intake. Things are predisposing to being overweight. They should actually eat to target an average normal weight.
The National Institute of Cancer Research and Treatment is also at the forefront of advocating for dedicated funding for childhood cancer in Nigeria. The theme for the World Cancer Day campaign 2022-2024 is Close the Care Gap. This is the third and final year of the advocacy. The day is about illuminating voices and bringing the attention of the federal government to the need to provide health equity, enhance cancer service accessibility, reduce disparities in cancer incidences and mortality to finally close the care gap. For citizens, experts here are advising a lifestyle change, exercise more, and eat healthy. Georgina Nwokwu, Arise News.
All right, let's have this conversation on the rising cases of cancer, the treatment and issues of wrong diagnosis in the health sector. We have in the studios Dr. Nwokwu, who is the National Coordinator, National Cancer Control Program, domiciled in the Federal Ministry of Health and Social Welfare. And also we have Associate Professor Musa Ali Gombe. He's the Director of Clinical Services, National Institute for Cancer Research and Treatment. Gentlemen, very warm welcome to Newsnight. I don't even, well, I know the questions to ask, but where to start from? Should I be asking Dr. Musa Ali Gombe, why is cancer more common today in Nigeria?
Well, there are several reasons why this is so. To begin with, there is generally an explosion of the number of cancer cases that you see across the world. Nigeria is also not left out, since the projection is that in the developing world, there is going to be doubling or tripling of the number of cases between 2030 and 2050. And also the lifestyle changes that we have adopted from the Western lifestyle modifications also have been affecting our population. For instance, maybe high fatty diets, maybe social habits like alcohol and the smoking, and also lifestyle of maybe adding of weight, obesity, that has been on the increase also, and also the now expertise. That's also another reason, the expertise, there are more people, more doctors, more specialists around that can tell you that this is your diagnosis. In the past, that was not also available. And also, if you look at the population, as the population ages, cancer is more commonly found in the elderly population. So, and it's more and more healthcare is readily available for the people now than before. So more people are aging and more cancers that we see.
All right. Dr. Uchechukwu, you want to give us, a statistical data indices. What I have here is that 120,000 Nigerians, get cancerous diseases, and that incidence seems to be rising. You agree?
Thank you so much. That incidence is actually projected. Because the country is projected data, which is from Globacan. So there's a new Globacan release for the country this year. But of course, that may not be out of place. Having been said that with improved capacity to diagnose the cancer diseases. So before now, it's been, many people may have died of cancer without knowing that they actually had cancer. So but now with increased capacity, with increased government efforts, with increased manpower in the sector, so diagnosis is now made and the registries are now collecting this data better. So that is why you see that increase. So it may have been there, but of course with exposure to more radiations, is also affecting the rising incidence. So, but for the country, so many cancers have been diagnosed. Breast, which is the commonest in the country.
Amongst women.
Amongst
prostates
amongst men, and cervical cancer amongst women,
women
is the third commonest cancer. So the colorectal, including liver cancers, is the fourth. Then leukemias and lymphomas is the fifth cancer.
Well, we're definitely going to come to all that, so that would analyze them again one after the other. But let me come to Dr. Ali Gombe again. What would you say is the main cause of cancer in Nigeria? You talked about lifestyle, some we've known deaths of prominent Nigerians, attributed to cancer, and yet they never drank, they never smoked, they ate healthy and everything, and yet they still have it.
Yeah, generally, let me start by
saying... Is it genealogical? Yeah.
Let me start by mentioning this statement first. Cancer, the cause of cancer in large cases is unknown. However, there are associated factors. These associated factors or risk factors that exist, and this will depend on the type of cancer that you have. So, but having said that, there are some of these common cancers that we have. There are some things that are usually associated with them more than the other factors. For instance, if you take breast cancer, being a woman is the most important risk factor for breast cancer, since in 99% of cases of breast cancers, they are women. So also if you take...
the cause is still not largely known.
Yes, but there are also other associated factors like I mentioned, increasing age, lack of children, age at which the woman attains menarche or menopause, the lifestyle that I mentioned, obesity, and also the age at which she also stopped having menses. All these things, they are things that that can affect the increase the risk of the woman.
Breast cancer.
Yes, breast cancer. So if you go to the prostate cancer, which is the most common cancer in men, also the most important factor there is age. As as the age of a man increases, usually after the age of 40, the higher the risks. But there are other factors such as genetic conditions and also smoking, and then maybe some chemicals, especially Agent Orange, which is not very commonly exposed to in the environment because it was a chemical biological weapon that was used during the Vietnam War.
All right. Okay. When you are the acting director at the clinical services of the National Institute for Research, Cancer Research and Treatment, and the rest. If you go on social media, you see different, advertisements, branding for one herbal medicine or the other, capable of curing cancer, shrinking prostate cancer, eliminating breast cancer in 1 week or 2 weeks. What are the dangers here? Are there dangers? Are they, certified herbal efficacies for the treatment of cancers?
Well, our own stand at the National Institute for Cancer Research and Treatment is that for any claim, like in any other discipline of medicine, if there is a claim for a particular drug that it has cure or you can achieve some response with the drug needs to be subjected to appropriate research. That is, it needs to be subjected to clinical trials for it to be validated that this claim that they are doing is correct. So that is my own take for any alternative or traditional medicine that that is claimed to cure.
To cure this or cure that, yeah. Okay, let me come back to you, Dr. Uchechukwu. What would you say, from your clinical studies and the rest and research, which would you say is the hardest cancer to cure?
Most cancers have their peculiarities. You are trying to ask a question, does it have any genetic composition? And the answer is yes. Okay, so it depends on the facility available facility available for such treatment, for such cure. So if cancers are picked up early, many of them are actually respond. I won't want to say the word curable, but the ones that are actually curable are mainly the childhood cancers. Many of them are curable. A cancer like cervical cancer is also curable if it is picked up early and treated. Okay, then if you use the right therapy for breast cancer, some of them will know those who have lived up to 15 years. So that can be said to be cured. So once somebody has survived cancer for more than 5 years, it is tagged to be cured, even though some of them may have to be on that treatment for life. Okay, so once the right diagnosis is made and the right treatment is commenced early, then many of them can live fairly long life. And in oncology can be referred to as being cured, because even though they may not go completely, but the person can live a fairly good life.
You talked about right diagnosis. Yes. You talk about, early detections and the curative incidents. If they are detected early. In most cases in Nigeria now, most of the hospitals and the rest will see wrong diagnosis. Chemo is another problem. The King Charles III now, we hear, is not going to take the English medicines, but is going to have a herbal treatment for his cancer. Prostate? Are we encouraging enough of that?
Well, the Federal Ministry of Health has a department of alternative medicine.
Yes. Okay,
so which is also expected to do research, like Dr. Gombe talked about. They need to subject those herbs to clinical trials and be sure of its efficacy. In Nigeria, you talked about some hospitals not having capacity to do the right diagnosis.
Yeah.
That was the case, and the Federal Ministry of Health and Social Welfare has taken steps to address that across all our hospitals.
Okay.
And that is where we are now. There's what we call the Cancer Access Partnership Program, where the government is partnered with some organizations to provide anti-cancer medicines at about 50% cost reduction. And the government has also introduced, through a partnership, a testing called immunohistochemistry. This will help us to detect which particular type of cancer and which drug is going to respond to. That is also coming on board. Some hospitals are already on, and we need to take this across the country to ensure that every federal government tertiary hospital has capacity to make the right diagnosis, because unless the diagnosis is gotten right, the treatment cannot be right.
Yes, except the diagnosis is gotten right, the treatment can't be right. And I want to raise the issue of chemotherapy again. Is it really efficacious? Is it helping, you know, cancer patients really, or worsening their conditions?
Well, as a trained oncologist, I would tell you that from my own personal experience and my training, chemotherapy helps patients, actually, but it has to be administered to the right patient for the right diagnosis, at the right dose, and at the right time. That is why we need capacity building in terms of having enough oncologists and other specialists in these areas, so that they will be the ones administering these drugs across the country. You know, chemotherapy are drugs that have been subjected to clinical trials. They have been found to be effective against several cancers. That is why they have been approved, and they are being used in many guidelines for the treatment of these cancers. So chemotherapy is useful, and there are also ways to manage those side effects. There is no drug that doesn't have side effects. Paracetamol has side effects, isn't it? But the way you take the drug and the way you manage the side effects is what is important. And as we used to say in medicine, the benefit outweighs the risks.
Yes, indeed. Maybe let's look at the collaborative efforts, you know, between you oncologists or cancer foundations. You talked about the Herbal Division domiciled in the Federal Ministry of Health and Social Welfare. And some people will be saying, what kind of collaborations do you have with the research institutions, universities, teaching hospitals, NIPRID, that is the Nigerian Pharmaceutical Research and Development, yes. NIPRID. Yes. What kind of collaborative efforts are you having? Is Nigeria developing a cancer drug?
So thank you for your question. The answer is that there is collaboration. Fortunately, most of the institutes are under the supervision of the Federal Ministry of Health. The National Institute for Pharmaceutical Research and Development, Nigerian Institute for Medical Research, National Institute for Cancer Research and Treatment, they are all agents of the Federal Ministry of Health. And that collaboration is encouraged for them to work together. So while the NIPRID works on the pharmaceuticals, NICRAT is also supposed to work on some sort of diagnosis, causes of disease prevention, and therapy, clinical trials. That is their major area of focus. And then NIMA is also working in other disease areas. So the collaboration is actually encouraged, and all of them report to the Honorable Minister of Health, and the ministry continue to encourage them to collaborate. Of course, the universities, the teachers also are affiliates of the have affiliate universities. So they also, and all the tertiary hospitals that also conduct research and treatment as well as service are all under the Federal Ministry of Health. 200
million Nigerians, and with all the medical strength of this country, we've not been able to produce a cancer drug.
Yes.
What progress are we making?
So unfortunately, yes, because of there are diverse issues that could be responsible, and the only thing we can say is that the country needs to also improve. But that is the reason for also creating institutes like NICRAT, so that they can also begin to do some research into clinical trials and then develop some medicines. But of course, developing medicines is not just a one-off thing, because there are other factors. You know, there are other factors that could also be responsible for some companies not citing their plants, because from economics, people cite plants close to where they get raw materials. Okay, so they need to also begin to do testing on our herbs and then other things that they need to derive those raw materials from. And I think we encourage them to also cite those plants here and begin to produce those medicines.
Okay, good defense there. But let me come to you, Ali Gombe, again. I mean, we've talked about all the vagaries of cancers and the rest. He was trying to list some of them. Maybe we should probably end with that. 5 cancers top most in Nigeria.
Okay. Just before this World Cancer Day, the IAC, that is the research arm of the WHO, released the recent data for the cancer across continents. And the recent data actually shows that Nigeria has almost about, it's an estimate actually for Nigeria, and the estimate is around 130,000 naira, just about 120, just a little about over 127,000.
Yeah.
Okay, and about that's the projection that was made in 2022, and about 80,000 of them died. So that's about 70% of the patients that were diagnosed in 2022 also died. And the top 3 most common cancers in Nigeria are the breast, followed by prostate, then cervix. However, if you take them in terms of the sexes, one is, for the females, is the breast, followed by cervix, then colorectal cancer. And also in men, is prostate, colorectal cancer, followed by liver cancer.
Yeah. Well, okay. Lastly, very quickly, are we closing the care gap for cancer?
I will say yes. Why I say yes is because the Federal Ministry of Health and Social Welfare has taken drastic steps to close that gap. It's recommended that for every 1 million population, there should be a linear accelerator. Okay, so that has not been the case before now, but this current government has taken steps to address that. So in this year's budget, the government has provided funding to at least procure at least 6 linear accelerators. So if that can progressively be done, you can be sure that over a period of time, we'll be able to close that gap of linear accelerator for the right population. In terms of medicines, we also, like I said earlier on, partnering with some organizations to provide access to cancer medicines at a reduced costs. And then the NHIA Act has also empowered them to also enroll all Nigerians on health insurance. Okay, that was the Act of 2022. So, and they just launched the operational guideline last year. So once that happens, then every Nigerian should have access to cancer care. Okay, so I think that care gap is being closed in the last 3 years. I can say that affirmatively.
All right, thank you so very much, gentlemen. Associate Professor Oncologist Musa Ali Gombe is the acting Director of the Clinical Services, National Institute for Research and Treatment. And of course, Dr. Nwokwu is the National Coordinator of the National Cancer Control Program, Federal Ministry of Health and Social Welfare. Thank you for coming to News Night.
Thank you for having us.
Thank you so much.